true. Training is very important, very, very, very critical when it comes to handling equipment in the laboratory.
Call for professionals when you have issues. Don't go and be looking for my brother or my friend. Call for professionals. They will also help you extend the lifespan of the equipment.
All right. Good evening once more, Mr. Yofak. Yeah. You're welcome to LabTalk podcast, and we're happy to have you. It's a pleasure to have you join us for this particular session. This session is episode 8 of our podcast, and the topic that we'll be discussing today is understanding equipment management, maintenance, and calibration in the laboratory. So we're delighted to have you share with us on this particular topic. So before we even go ahead to discuss the topic, we'd like you to tell us about yourself. Before then, how do you feel about the session?
Mr. Kevin, thank you very much. Thank you for the opportunity. Thank you for the invitation. For the session, I will not only talk about this session. I've been following your pages. I've been following the other sessions, and I was really very interested knowing again that this is being done by Cameroonians. And my joy was even very big again when I noticed you are a colleague. So that's why I say, oh, why not? Why not contribute? Because equipment is a part of the laboratory that we cannot separate.
Yeah.
So thank you for the opportunity.
Oh, thank you very much too. I'm glad you found what we are doing very interesting and very educative. It's an amazing pleasure to have a colleague, just like you said, join us here on set. So tell us about yourself. Tell us about your career journey. Where did it all start, and how is it going so far?
Okay, I am Tajo Jofak Martial. I have a technical background, mainly electrical power system. Calibration, equipment maintenance and calibration, the whole history started in 2014, where Professor Patrick Duking, the executive director of Global System Solution, gave me the opportunity to be part of the first ever training. And then after this training continued in 2016. So in December 2017, we effectively started this activity in Limbe. That was calibrating equipment. And I can say Global Health System Solution is the first in Cameroon who started this activity back then in December 2017. So far, we have covered so many laboratories in Cameroon, laboratories that we have helped them gain the ISO accreditation, so many of them. And we continue this activity in Cameroon today, covering so many laboratories across 8 regions in Cameroon. And we have also covered laboratories out of Cameroon in the Central African, in the West African sub-region, in Senegal, in Benin, and so on. So far, that's how we have been operating, and we continue operating on the field.
Wow, thank you very much. An amazing journey so far. That's truly, truly amazing. Equipment maintenance is something that is not really talked about. It's always an issue that is being dealt with at lower level in the laboratory, not really spoken more often about it. I'm really glad to be here with you to discuss about this important topic, about equipment generally. So I'll start by saying that most laboratory, when we talk about quality management system, always talk about administrative responsibilities, leadership, doing a test here and that. And sometimes we deal less about equipment. We only talk about equipment when it comes to maybe buying an equipment for the laboratory. So I would like you to tell us, why is equipment maintenance and management so important and critical in the laboratory?
Okay, thank you very much for this question. Equipment is part of this system. When you look at the slanted diagram, the 12 elements of the SLAMTA diagram, you will find equipment. This already show you how important this aspect for the laboratory. Now, talking of equipment, we cannot have patient result without equipment.
Oh, sure.
We cannot have this. It is not possible. Be the pipette that we use, be the centrifuge that we use. It is not possible to have patient result without equipment. So equipment maintenance or equipment calibration, it's very important in the laboratory to have accurate results, yeah, and make sure patients are being followed up critically. Last but not the least, if you look at the SLICTA checklist, which we use to accredit the laboratories, yeah, section 5, we have a whole section on section 5, which talks about equipment management completely. This shows you how important equipment are for the laboratory.
Thank you very thank you very much for that answer. It's true. Equipment is an integral part of the quality management system. It's a whole subject on its own. And just like what you said, you can't have accurate and precise results for patients if our equipment in the laboratory are not properly handled. No, there are several issues that we need to deal with, be it control every morning and all of that. So I want to add, what are the components when we talk about the management of our equipment, right? What are the components in equipment management that a professional should follow in the laboratory? What are those
Thank you for that question.
effective steps?
Thank you for that question. Those components, we have several elements that enter into consideration, be it from the purchase to the end user, which is the lab personnel. I will start with the end user. Equipment management starts with what we call it in French, besoin. The lab technician will tell the administration what he needs. Start there, right up to the administration. Now, when you purchase an equipment, one, training, you need to train the personnel on that equipment. You need to install that equipment properly. You need to label that equipment. That labeling takes into consideration so many things. The make, the model, the serial number. The installation date is very important and key because each equipment has a lifespan, which most of the laboratory people, they don't look at it. It is found in the notebook that accompanies. In equipment management, the key thing is the need.
Mm-hmm.
The need. Yeah. The lab personnel will give the need. Management will analyze the need. Mm-hmm. And then the equipment is labeled installation date. Installation date is critical because it goes along with the lifespan. You go into some laboratories, you will see the life book of equipment from the day it was installed, all the different interventions that this equipment is a key of the manufacturer.
You explained the various components of equipment management in the laboratory. You mentioned a point on, first of all, the need of the equipment in the laboratory, which is very important. You cannot go and request for equipment that you don't need in the laboratory. And the next thing you said was the purchasing power of the facility, because it will not make sense if you go and order an equipment that the laboratory or the facility cannot buy. Maybe the purchasing power of the hospital is maybe 5 million. You go and order equipment that costs maybe 10, 15 million. It won't make sense. So first of all, evaluating the purchasing power of the facility before placing an order. So my question is about the lifespan of the equipment in the laboratory, right? Which is a very critical point. I can say most laboratory sometimes never consider that. Maybe there's an equipment in the facility that has to be in the laboratory maybe for 5 years. You come and meet the equipment that's been there for maybe 10 years, 15 years, and it has not been replaced. How do you now handle such scenarios in the laboratory? What do you do? What is the action point, the action step that you take to mitigate that particular issue?
That's where the training comes in.
Wow.
you
Mm-hmm.
install the equipment, you train the personnel, and
Mm-hmm.
then each equipment comes with their manual.
Mm-hmm.
Each equipment comes with a manual. During that training, they need to go through that manual. It is in each manual, it is specified. The manufacturer specified the lifespan or the duration of this equipment, because he knows that maybe after 10 years, it might still be working, but is it going to give the same results or the expected results? Even though it's being maintained and calibrated regularly, after that specified period, it is going to be challenging to be having the expected results.
That's very true. Training is very important, very, very, very critical when it comes to handling equipment in the laboratory. Because sometimes, like this particular aspect of training, I would like to push the question further by saying that in a scenario where maybe there's a particular set of staff that you met or when you install that particular equipment in the laboratory, right? Let's say you met three staffs at the facility, you train them on how to use the equipment. Then maybe after 3 years, 4 years, the manual gets missing and the staffs are replaced. How, for this particular scenario, how is it done?
Uh, Staff turnaround has always been a challenge in laboratories, not only on the equipment part,
Yes.
not only on the equipment part.
Mhm.
Now, records.
Mhm.
Records will help us.
Yes,
Records. We need to keep track. What is not written is not done.
exactly.
We need to keep track of everything that has been done on this equipment. That's why equipment have that book of life. Each intervention on that equipment is being written. The training, most of most of the times during this training, they give training modules or manuals to the participant. It is not the participant's book. It is for the laboratory, not for the participant. So we are supposed to find that manual or the training manual in the laboratory. Most of the times we go to laboratories, you don't get the manual of the equipment. The
Yeah.
internet has helped us today. You take the make, the model, and the serial number of that particular equipment, you
Yeah.
Google it, and you can easily download the equipment manual, which will help us to train other lab personnel.
Well, thank you very much for that. I think that's the best solution. Documentation. I think that's a topic that we discussed last week with Madam Simen Anna. She mentioned that particular critical point of documentation. You cannot keep assuming things in the laboratory. It has to be written down. You will not come and imagine that maybe looking at the color of the equipment, this equipment might have been in the lab for 2 years, 3 years, but it has to be documented to be sure that what we are doing is actually appropriate. Thank you very much for that answer, and it's going to help a lot of staff when they listen to such. Uh, the next question I'll ask is about preventive maintenance and calibration. What's the difference? There's
Okay.
preventive maintenance, curative maintenance, calibration. How do you distinguish all of those terms and the laboratory? If it's a junior professional that is asking this question, how do you differentiate that?
Preventive maintenance and calibration, they are really quite different.
Yeah.
Preventive maintenance are all the little actions that we carry out on an equipment that will help reduce breakdown, that will extend the lifespan of this equipment. Let's take example, a centrifuge.
Yeah.
What we advise and what we recommend is that each time you finish using this equipment, you clean with 70% alcohol. Why? Because there are debris
Mm.
in the equipment that can cause corrosion. There are deposits like dust.
Yeah.
Dust is one of the enemies of equipment, not only laboratory equipment, but
Mm.
anything that concerns electronic equipment.
Mhm.
So preventive maintenance are all those little actions that you take. Cleaning, everyday cleaning, and document.
Yeah.
Now, calibration is that action that will make you know that this equipment still for a pipette, that pipette from maybe 10 to 100 microliter.
So sorry, can you come again with the definition of calibration?
Okay, calibration is this action that will make you know that equipment works within specifications
Mm-hmm.
or within the manufacturer specifications.
Mm-hmm.
Let me just give you an example. We have so many equipment in the laboratory. Let's take, for example, the micropipette. You have a
Okay.
micropipette that ranges from 10 to 100 microliter. You're pipetting 100 microliter. How are you sure you are really pipetting 100 microliter? That's where
Good.
calibration comes in.
Yeah.
Calibration comes in now to verify and compare. Okay, this is the state of this equipment. You
Mhm.
verify. If it's not pipetting that 100 microliter, what do? You adjust. You adjust and make it work at that 100 microliter. Take, for example, a centrifuge. How are you sure this centrifuge is running 5,000 RPM? It is
Really?
calibration that will tell you
Mm.
this equipment. Laboratory personnel, it is rotating. That's all they know, and that's what they want to do is
That is
rotating.
true.
How are we sure this equipment is rotating at 5,000 RPM as recommended for that particular sample?
Wow.
That's where calibration comes in. We come and we control that speed. If it is not running at the set speed, we have a series of techniques to bring it back to the right spot. There's one thing that uh, cut across the two of them. You know, in Africa, generally, we have this power outage. That's one of the first causes of, you will see, first of the one of the key things that will make equipment have breakdown, you have this frequent power outage. And even for calibration, when we are calibrating, for the equipment that we plug on, that needs electrical power system, we will notice that, okay, it is due to this on and off, on and off, on and off, on and off. Some part of them, they start behaving funny.
Yeah.
So preventive maintenance and calibration. Preventive maintenance, we are trying to avoid breakdown
Yeah.
with all the little actions that we carry out. You finish working in a biosafety cabinet, you clean with.
I'll just throw a little point on that. What you mentioned about calibration, right? How do you know that the equipment is really functioning? Especially with pipetting, maybe an exam like HIV test and others. Imagine the procedure tells you to pipette 50 microliters. You are there pressing the pipette thinking that it's 50 microliters. Meanwhile, you are pipetting maybe 10 or 25 or 30. And you are sure in your mind that you are pipetting a normal ratio. And I would like to ask a follow-up question of that. At what point can a laboratory professional suspect that this equipment has gone out of use or it's not working properly? How can a laboratory professional, maybe, is there a clue that the professional can observe and say that no, this equipment needs calibration?
Sure. So, you know, when we come maybe for corrective maintenance or for repairs, the first person that helps us is the user because he will be the one to tell you this centrifuge is making a funny noise. You, this refrigerator is icing. Meanwhile, it's not supposed to ice. A refrigerator is not supposed to ice. He will be the one to tell you this refrigerator is icing, or he will be the one to tell you this biosafety cabinet is alarming. It's giving the end user has to pay attention to. Let me say the laboratory personnel have to pay attention to any slight difference from what they have been having since the first day they installed the equipment. Take for example, okay, you're supposed to separate a fluid, you put it in your centrifuge, but you take it, you still see some bubbles inside. It means this equipment has an issue. End user has to pay key attention to all those details.
Wow. Thank you very much for that. Thank you very much. And still to continue, you mentioned a point about scheduled maintenance of the equipment, right? I believe every equipment has maybe this routine timetable to come and either check the machine. That's routine maintenance, I will call it like this, right? how does it vary, those maintenance? Does it vary from equipment to equipment, or is it specific? Is it specific for all?
Come again. I did not get the
Uh,
question.
the question I asked was about routine maintenance. My question is, does it vary with equipment, or is it standard for every equipment in the laboratory?
You need to, it varies. It is not standard for all equipment.
Mhm.
You need to look at the manual. The manufacturer gives guidance and frequencies of actions of routine maintenance action that has to be carried out on each piece of equipment. Routine maintenance that is being carried out on a centrifuge or the frequency will not be the same with that is being carried out on a refrigerator, for example. So you need to stick to the manual to look at the recommendations of the manufacturer.
Okay, okay. Thank you very much for that. Now we'll go to I'll ask a question now, which is related more to the staff, the personnel in the laboratory, right? I think you answered some of the questions regarding equipment maintenance when it comes to the personnel in the laboratory. What are those challenges that most laboratory face or personnel face when it comes to equipment maintenance? You talked about a point about being keen to the changes in the equipment, be it sound, be it maybe the temperature of the equipment and all that. What are those challenges that some professionals face when it comes to the maintenance of equipment in their facilities?
One of those challenges is the lack of training. The lack of training, which is very key. We need to train them. It is not only biomedical engineers that have to be trained. Laboratory personnel have to be trained because they help the biomedical engineers in their day-to-day activity. The other thing is that laboratory personnel should be involved in the supply chain.
Wow.
They should not just be surprised with an equipment in the laboratory like that. Yes, because we've seen cases whereby you go to a laboratory and equipment is there, nobody's using it because they were not involved in the supply chain. They bring in an equipment that the laboratory does not even need.
That's true.
So we'll come back to that issue of the need. Lab personnel has to be involved in the supply chain. Okay, which equipment do you want? We need a centrifuge, a refrigerated or a non-refrigerated. It is only the laboratory personnel who will know that I need a non-refrigerated or a refrigerated centrifuge. It is only the laboratory personnel that will know that, yes, I need a freezer or a refrigerator, or I need a CO2 incubator, or just a normal incubator. They have to be trained. They have to be involved in the supply chain.
Wow. Thank you very much. Those are very, very pertinent challenges. And it's very, very common. Very common. You
Common at times because we in the laboratories we know how we function in these our low resource countries. We have donations.
Mhm.
At times before they bring that donation, they will not even seek for, or they will not even ask you, well, what do you guys? They will just bring equipment like that.
Yeah,
You will be surprised, and equipment just comes in. Maybe it
exactly.
does not even matches the needs of the laboratory. So
Mhm.
staffs have to be involved in supply chain.
Exactly.
That's one key issue.
Very, very, very pertinent because I've
That's why we call them the end users. We call
uh,
them the end users. He is the one using it, so he knows what he wants.
all right. I was talking about an issue about donation, just like you mentioned, right? Because I've been to laboratories where there are equipment just everywhere around the laboratory, but you don't see them using it, and you wonder why the equipments are there in the first place. And you've just mentioned the cause of all these issues in the laboratories. You just come to the laboratory and they give you an equipment that you don't even need. Meanwhile, that's a point that you mentioned at the very beginning when you talked about the elements in equipment management. First of all, the need of the laboratory, which is very, very important. Thank you very much for the answers that you've given. Uh, the question I'll ask, which is the last but not the least, I will say is, what I will say is this: when it comes to sudden breakdown of equipment in the laboratory. Maybe you are running a test, maybe on an equipment, and the equipment suddenly breaks down. What is the response that the staff should take? What should they do at that particular instance in situation where there's a sudden breakdown of equipment?
The first thing to do is to completely stop using the equipment and carry out a risk assessment. Secondly, you need to label and isolate that equipment. You go to some lab, you see out of use or under repairs, you need to isolate and label that equipment. The thing to do is to activate your backup system if at all you have a backup system. The backup system can be maybe another equipment in the storeroom or maybe another equipment, the same equipment in a different unit. You activate that backup system. Maybe you go to that unit and finish the test that you were carrying out. The other thing is to notify all the possible stakeholders, be the lab head, and then right up to the top administration. The other thing to do is when that information goes up, now the next step is to engage the repairs. Engage the repairs of the said equipment if at all it can be repaired. And then the last thing to do is to evaluate the damage to the test result. Evaluate the damage of if you need to maybe to recollect that sample, maybe you need to evaluate what is the effect of this sudden breakdown on the test result of this patient. I think generally, globally, that's what we have to do in case of sudden breakdown of an equipment.
Okay. You mentioned one should I say strange point? Let me not call it strange point. You mentioned something unusual about backup, right? Looking at our own
Yes.
setting, right? Resource limited. I don't think most
Limited.
laboratories have maybe an equipment that they are using and maybe a secondary equipment by the side in case of breakdown of the first equipment. When you mentioned, I was like, does this really happen in an African setting, or is it a standard? Because laboratories that I've mentored, they first of all have a challenge of getting equipment, not talking about the backup. So how can laboratories go around this?
That backup system, we can look at it in two different angles,
Mhm.
right? The first angle is that, okay, yes, they have a complete equipment in the storeroom where if this centrifuge is declared bad or this centrifuge has a problem, they go to the storeroom, they remove the new centrifuge and they start using it. That's the first angle, which is the most difficult part of it. The
Mhm.
second angle of this backup system is maybe, okay, you leave biochem, you go to hematology and maybe you centrifuge, or you leave this unit and go to another unit and
Okay.
use. I've seen laboratory settings where all the units they use one centrifuge is there and everybody comes and stand and line up. We know we are in low
Yeah.
resource countries. We
Mm.
do with what we have at hand.
Wow.
So that's how we can look. Laboratories they have this backup system, but when it comes to this bulky equipment, this heavy equipment, it's difficult. You see them having thermometers in the storeroom, having pipettes in the storeroom, having timers in the storeroom. When it comes to this small equipment, which are not really that expensive, they have them. But the more you move forward, the more
Yeah.
it becomes challenging.
Yes. Because getting a backup equipment, maybe for let's give for example a Randox that costs maybe 50 million. I don't think I don't think a laboratory will be ready to maybe disburse another 50 million and be saying that in case of in case of
No.
they'll prefer to be very frequent with the maintenance and ensure that the equipment is operational at every time. So thank you very much for explaining that. And the second option of backup that you explained, I think that's something that is used in the laboratory frequently, that you can go to another unit and carry out the activity that you need, maybe pipetting or centrifuging the sample that you need. It's very frequent. I've seen that for myself. So that was that. Thank you very much for that answer. I think we are getting closer to the end of the session. The last question I'll ask will be, I would say, an inspirational question, or I would like you to talk to a professional, a younger professional who is maybe graduating in a few weeks or just entering into the profession, be it medical laboratory sciences, be it biomedical engineering. What will you tell that student? What will you tell that professional?
What prompts you to come into this milieu? Because as for me, I came to this milieu patient concern. So every day before I go to bed, I make sure I learn something new which will help me in this domain. And then that will reduce equipment breakdown. This will also enhance reducing downtime in patient results and all the rest. So you just need to tell them from experience, love what you're doing, take it seriously, learn from elders,
Yeah.
from people that already have experience, listen to recommendations, follow to the key recommendations.
Thank you very much. That is going to be very, very essential for a laboratory, for a student who is coming up in a profession. Very, you have to take your profession seriously. Definitely. Everyone has to do that. And it's true that some recalcitrant student, I think this type of advice will go a long way to help them. So I would say thank you very much for being here and for answering the call and to share your knowledge with our community. It's a growing community, but we're happy to have you join us and to share your wealth of experience with us when it comes to the management of equipment and how to navigate equipment maintenance and calibration in the laboratory. We're really happy to have you. Thank you very much, sir.
Thank you, Mr. Kevin. I will not go without saying this.
Yeah,
Laboratory personnel or the administration, in fact, together with the administration, is to follow recommendations given to them. Because when we come to the field, we always leave recommendations that will help extend the lifespan of our equipment. Plug your equipment on a on a on a, on a backup system. At least that on and off will not affect your equipment that much. Call for professionals when you have issues. Don't go and be looking for my brother or my friend. Call for professionals. It will also help you extend the lifespan of your equipment. And then the last, I will seize this opportunity to thank Global Health System Solutions because for the past 8 years now, we have been on the field carrying out this activity. And I will tell you, we have noticed a great change. Today, we have almost seven laboratories that are ISO accredited.
yes.
Recently, Regional Hospital Ngaoundere, Kreza in Yaoundé, Regional Hospital Mara, they were ISO accredited. It's a part of the job that we carry out. And this is also thanks to the state of their equipment. Global Health has taken good care of this equipment and they are giving great results. Thank you, Mr. Kevin.
Thank you very much. Thank you very much for highlighting this particular point. I think this is going to be at the forefront of our publication, mentioning and highlighting global health system solution.
Oh,
We
sure.
are doing amazing because I'm part of the team, right? We are doing amazing things in the field, be it mentorship of laboratory professionals, be it at the level of equipment maintenance, just like you are doing with your team, and many other things, right? The work Global Health System Solution is doing in Cameroon is really amazing. And I would like to just say that who is going to be a pleasure to continue impacting laboratories around the country, right? Why not going, presently we're in 8 regions, why not extending to other regions and continue the amazing work that we're doing already in the field and providing good quality services to our patients, right? So it's really a pleasure to first be working with Global Health System Solution and giving us the opportunity to impact those laboratories, right? It's really I would say, a rare privilege to first of all come into such team of quality managers and people that love to see things being done the right way. So thank you very much for highlighting that particular point. So we'd love to have you again on set and to discuss other topics, right? We're not just talking
For
about
sure.
women, we are discussing several other topics. And in the long run, we will have to go detailing in several topics. Maybe your profession, we'll go into calibration more detailing. How is it done? How do we navigate through calibration and all of that? So we'll have more sessions to come and we'd love to have you join us on set. So thank you very much for being here and thank you very much for joining us.
Thank you, Mr. Kevin. Look forward to the next invitation.
All right, all right. Thank you very much.